Okay, good afternoon, everybody. Can you all hear me there? Is it clear enough at the back? Can I have a wave if it's clear at the back? Yeah. Okay, we're clear. Okay, thank you very much indeed. Well, welcome everybody to the annual members meeting. John,
Could you bring it up a bit, please?
the mic, is that better?
No. A bit louder, please.
The mic doesn't change.
Oh, the mic doesn't. Do you want me to I'll just shout a bit, John. Is that all right? Or come and sit here, John, if anybody's having difficulty.
Can I sit there?
Yeah.
Is everybody else in the room okay? Is that all right? And is it okay online? Yeah? Okay, well, as I say, welcome to our annual members meeting here at SWYPFT today. Obviously, my name is Marie Burnham. I'm chair of the trust, and I'm pleased to welcome everybody both face-to-face and indeed online today. We're trying to do it in a kind of mixed virtual as well as face-to-face, so thank you, everybody. Before I start, though, I just want to do some housekeeping. They always say that to the first speaker, don't they? So I'm going to have to read this out because I'll never remember it otherwise and I'll get it completely wrong. So there is no planned test for this afternoon. If the fire does sound, please, it's this door here out at the side, and there's a fire door there out at that side as well. So there'll be a member of staff there. Please follow the member of staff if that's okay. The meeting is being recorded and will be published on our website. So if you miss anything today, or John, you're having problems listening, then please feel free to visit the website. Excuse me. We're also joined by a member of governors. You'll also hear later on from John Leville, our lead governor. And I'd like to take this opportunity to enormously thank and heartfelt thank for all our governors for the important work they do. But I'm going to do it slightly different to that. So basically the fire alarms is the main thing. Out the door, follow the staff if there's anything. There are toilets out there as well if anybody needs them. We've had our marketplace, which I'm sure you've all seen as well. For me, there is a statutory obligation as a foundation trust, and that obligation as a foundation trust is we have a what we call a members' council, a board of governors. Governors are the most important thing to me as a chair, in the sense that from a governance perspective, they hold me to account, they appoint the chair, they hold non-exec directors to account, and we appoint our chief executive and executive directors. Every one of our governors are voluntary, they're not paid, and they come from various backgrounds. So, for example, we have governors who are staff governors, we have public member governors, and organisational governors. You'll hear more about that from John Leville. But on behalf of myself as a chair of SWYPFT, I'd like to say thank you very much indeed for all the time our governors give to our organisation. We also, as an organisation, have a statutory duty to hold, and this was in my day called an annual general meeting. When you're a foundation trust, it's known as an annual members meeting. It's exactly the same thing. I hope we will present this afternoon everything that's gone last year and bring you bang up to date where we are at the moment. So if there's anything you want to pick up from members of the public, we take questions. I'm looking at Andy. It's towards the end, isn't it, Andy?
Yes.
Yeah, at the end. Okay, before we start though, and I think it's really, really important it's all about remembering why we're here and what we do. And for me, when I took the chair's job on, the most important thing for me is to look about the people we serve. They're the most vulnerable people in society. And if we do a good job, we actually know, therefore, the service to our service users will therefore be good. It's therefore important that we are there for everybody, whether it's mental health, our community services, and the people we serve in our communities. I want to play a video now. It's only a short video. It's about 3 minutes. And if I can take of your time, we've got videos throughout the day. And I do think what it gives is a flavour of the kind of work and the people's lives we touch as an organisation. This particular video is about the individual placement and support services that provide employment for people in Wakefield, Calderdale and Kirklees, accessing mental health services who are interested in finding paid employment, who may want to work or have been struggling to work due to ill health. And I think it's a beautiful video to start the afternoon off, which shows the benefits people are having getting back into work and getting that self-worth back. So after myself, I play that, we'll talk then, we'll move on to the annual report. You should have the agendas in front of you, and I'll then hand over to Mark Brooks, our Chief Executive. So 2 minutes of your time, please. Thank you.
It wasn't just a job, it was my first proper job, and it was a really big deal. have mental health, you have got to keep busy. Even if it's just tidying your flat out, hoovering, or taking your washing to the laundry. A while ago, when I was doing nothing at all, I was doing that every day, and just my mental health didn't improve at all. I'm a grafter. I love grafting. Halfords, charity shop. I like grafting. I like keeping busy. It's like exercise for the body and the mind. You know, you got nothing to lose, so do it.
I didn't really know what to expect until you came in, and my therapist introduced me to you, and you spoke about the stuff that you can help us with, you know, about getting confidence, about getting back into employment, taking steps slowly, and for you to saying that you'd be working in conjunction with my therapist. I find it's just being able to offload truthfully about how I'm feeling, about my fears, about my things that I'm kind of scared of, having not worked for a long time. Fear is a big thing for me, and to understand that that's kind of perfectly natural, and to learn coping mechanisms. But also, so much as like me telling you what I'm interested in, and you've been able to help me look for jobs, or me finding jobs myself and telling you about it. And you know, we filled out an application form together, and I don't think I would have been able to do that by myself, you know, so you gave me the courage to be able to do that, but you also showed me the skills. And I thought that my mental health would be a massive barrier into kind of finding work. First time in 5 years, I've got an interview next week. Ben's going to be there with me. We're going to meet afterwards for like a debrief and a coffee and stuff. The support you get is unbelievable. You know, I don't think that you were like me, that you couldn't do anything, that you were destined to be on benefits for the rest of your life, and that you weren't worthwhile, because one thing that this service does give you, which I've never had before, is hope. It gives me hope that I can better myself. It gives me hope that I can, you know, I can actually be a participant in society. You know, if you're like me and you're coming into the service and you're new and you're scared, just don't be, you know, because these guys, you know, these men and women will do everything that they can for you.
Okay, thanks Marie for that introduction. As Marie said, I'm Matt Brooks. I'm really privileged to be Chief Exec of this organisation. It's my delight to speak to you today. And what we're going to do through the next hour and a half is take you through, as Marie said, what's happened during the last financial year between 23-24, bring you up to date with the context we're currently operating in, and you'll have a chance to hear from a number of our colleagues. Adrian will talk about finance and Amy about quality, and John, as lead governor, will give his annual report as well. And I'm really excited as well, actually, that Dawn Lawson, our Executive Director of Strategy, is going to be launching our new strategy today. So hopefully that'll be a really good and uplifting part to end the meeting on. In terms of today, I hope you all got the opportunity to attend the marketplaces outside beforehand, and a really big thank you to everybody who contributed to those. I thought they were exceptional, and they're just a small sample of some of the services that we provide, or the work that people do in the organisation. Hopefully we'll get a chance to share quite a bit more of that with you during the next hour and a half. So if we could maybe move on, please, Andy, to the next slide. And talk a lot about our mission and values in our organisation. And as Marie said, we're all here for one reason, and our mission is to help people reach their potential and live well in their community. And it's just a small number of words, but I think it so fantastically encapsulates what our trust is all about. And that's what our staff do day in, day out. And I think as part of the annual members meeting, what I really want to do is pull out the examples of where we're achieving and providing such fantastic services for the members of the community that we're serving day in, day out. As I say, we are a values-based organisation, and we try and make those values real in the organisation. If you look over there, you'll actually see our behaviours. You've got the values down the left-hand side and the behaviours down the right-hand side. What we have, though, we have values-based recruitment. If anybody's been recruited by the organisation, our interview process, recruitment process is based on our values. The way we set our objectives, they're based on our values. the way that we appraise our staff is based on values, and we like to share stories of where we've lived them well. We start our trust board every month with a service user story or a service story that really tries to exemplify how we've lived our values. We don't always get them right, and if we don't, we need to learn from them. But I'd like to think that is something in our organisation that really makes a big difference. It enables us to make a positive difference in what we're doing day in, day out. We want to make our values real, and we want to make our values live. So if you just move on again then, please, Andy. I'll talk a little bit about actually what's happening in the real world today, or certainly in the NHS world. And there's an awful lot happening, I think, in terms of context. Obviously, everybody's familiar that we have a new government. That's going to take a little bit of time in terms of understanding what it will mean for health and care. One thing that's been very noticeable, there's been 2 meetings that I've attended in the last 3 months that the Secretary of State has attended as well. Don't think I attended any meetings with the Secretary of State in the previous 3 years of doing this job. So there's obviously a desire, I think, to engage with the NHS. What we saw last week was the publication of the report by Lord Darcy, which identified quite some significant challenges the NHS is facing, and I'm sure how that progresses will become very, very clear as the government works towards developing a 10-year plan for health and care for next spring. So that's the new government. And we operate obviously in an environment where we are funded by public monies. So we will have to work very closely with what the political environment tells us to do so. What we have seen is a significant change in demand and expectations, I think, particularly since the pandemic. So I'll just give a couple of examples of how that's really impacted upon the services we provide. People seeking a diagnosis for ADHD. The number of people, the percentage increase we've had since 2019 is 560%. That is a huge level of increase in demand. The number of children, younger people seeking mental health services referred into our services since before the pandemic has increased by more than 40%. That clearly has an impact upon waiting lists, waiting times and accessibility of our services. So some of the demand that we're seeing is not what we were used to before the pandemic. That's maybe not the same for all services, but certainly I think mental health in particular as a sector is witnessing and experiencing high levels of demand for all the services we're providing, which clearly has an impact upon the service we provide and all of our colleagues. One thing that I can say, I think, since I think I first spoke in this position in 2020, is it's been quite a challenging time for recruitment. As an organisation, we've actually fared pretty well. We've actually recruited more staff over the last 2 or 3 years than we have done in previous years. So we're actually better staffed now than we have been for a while. They may not always be in the place that we need them to be, might not always be the right skills, and we maybe haven't got all the staff that we want, but we're in a far better position than we were 2 or 3 years ago. Financially, I think we all read the headlines, we all hear the news. It's a tough environment actually for all public sector, and the NHS is no different. We've been hearing a lot of news, and I think only last week it was really clear there will not be any further money for the NHS this year, and any additional monies in future years will need to demonstrate that we're reforming the services we provide in order to access them. Cost of living actually has an impact on many of our service users. We have people who live in very deprived areas. We have vulnerable people who are dependent upon, I guess, some state provision, and the cost of living can have a real impact upon them. So that is something, I guess, in the context of how we're providing our service, something that we're very cognizant of. Winter is always tough. It was very tough last year in terms of the demand being placed on all of our partners and ourselves in terms of the additional level of demand. And we're still actually, albeit quite a number of years into the process, we're in a changing environment in terms of how we work in partnership. We are part of our integrated care systems. We work in both West Yorkshire and South Yorkshire. We work in 4 places, in Barnsley, Carcleys, Calderdale and Wakefield. And we're learning to work with each other to try and provide as much seamless care as possible. So that's just a small example of some of the, I guess, demands and pressures on our service and the context in which we're operating. So if I just move on to the next slide, please, Andy. And I certainly want to make sure that I recognise changes in leadership that we've had over the last year. So very pleased that John Head actually started with us a couple of weeks ago as our new Chief People Officer. John's a vastly experienced HR professional. We're absolutely delighted to welcome him to our organisation. In terms of our non-executive directors, we've got a couple leaving, so a really big thank you to our who's been our deputy chair and senior independent director, Mandy Rayner, who's leaving us a couple of weeks' time. Mandy, actually, isn't it? And similarly, Kate Quayle, who's actually been with the organisation for 7 or 8 years, her term's come to an end and is leaving at the same time as Mandy. We did have an associate non-executive, Rachel, who again actually left us during the year. So what we have got, just in terms of recognising those, we've got 2 new non-executives joining us in a couple of weeks' time. Margaret Kitching, who some people may be associated with the NHS may have heard of before, former chief nurse for NHS England across the north of England, and Gary Ellis will be joining us as well. Gary's a qualified accountant and got a lot of interest in local community, so really looking forward to welcoming them. But particularly thank you to Mandy and Kate for all the time and effort they've put into the trust over the recent years. So if we can just move on again, Andy, and I talked a little bit about place and partnership, and this is really important. So that shows you, I guess, the vast expanse of geography in which we're working across all of our places, and those of you that live in our places know how very different they all are as well. And I think it's a real insight to actually to provide service into so many different places and work with so many different local communities. And we're really fortunate that our staff, I think, have got a lot of local affiliation to our communities as well, and really support the communities as well as they can do. In blue along the side is an example of all the different meetings that we attend, or just some of them, with partners. So that might be with primary care, with acute providers, other community providers, local authorities, voluntary sector. And the aim of working in collaboration is to try and make our care as seamless as possible for the people receiving our services. And I'll just make that a little bit real if I can, just for a moment, and give you some examples of what we've been doing over the years. And we've still got a lot more work we can do, but in Barnsley, working in partnership with our other organisations, we've developed rapid access clinics for people that are frail. In Calderdale, there are significant life expectancy challenges and health challenges for people with a severe mental illness. Working in collaboration again with partners, particularly primary care, we've seen the number of people that have had with a severe mental illness receiving an annual health check increase from 14% to 71% over the course of a year. That can make a massive difference to somebody's life if we can catch disease or a condition early. In Careclease, we work together with partners on what we call the Well campaign. So we've got programmes about starting well, living well, ageing well and dying well, and our organisation is working with the Acute Trust, with the Community Trust, local authority, and how we can actually do that to the best of our ability. Wakefield, we have a well-established mental health alliance where we work actually with our voluntary sector and independent sector partners about how we can best deliver mental health provision across the geography of Wakefield. And in all of our places, again, very similar to people with a severe mental illness, people with a learning disability have a much lower life expectancy than the general population. Having an annual health check can make a huge difference, and working collectively with partners, at least 75%, in some cases up to 85% of people with a learning disability are now receiving their annual health check, which is a huge improvement and can make a real difference to people's lives. So I think what we're going to do now, Andy, unless I'm much mistaken, is just show another video, and this is from our Calderdale Early Intervention in Psychosis team, and it's just an example of what they've been doing to really improve people's lives and help and support well-being.
So wellbeing paddles are just 2-hour sessions on the canal for anybody that feels like they're suffering with mental health. It's an amazing way to get exercise, it's a good way to be in the outdoors, get fresh air.
Our service treats people who have psychosis or are at risk of some other mental health problem. We try to treat people in the community and get them out and about. So we make contact with Black Dog Outdoors because they share the same values as us in terms of wanting to improve people's mental health and well-being.
It calms me down. You realise things that you think are important, they're not important, and you can just escape and see things and just have peace.
We really enjoy working with Black Dog and we get on really well with them. We've been able to extend the sessions from once a month to twice a month due to the demand that it's created.
Truthfully, if these guys weren't here, I don't know where I would be.
It's a really good therapeutic thing that's being offered here, and we're just so glad we've got the opportunity to do it.
Privileged doing this job actually, and I think one of the best things about it is actually when I get the opportunity to go and visit teams, and then what you actually realise is you've got people like that who are actually putting so much effort into actually making people's lives better. It just makes you truly humbled and really thankful for working with such fantastic colleagues, and I think we're very fortunate in SWYPFT to have that running throughout the vein of our organisation. So these are our priorities. So what we do each year, we actually set a number of priorities around our 4 strategic objectives. Now, as Dawn's going to tell us later, we're actually in the middle of changing these, but as we're talking about 23-24, I'll tell you what we had as priorities really for that year. And we set priorities around our 4 key objectives, which are about improving health, improving care, improving the use of resources, and making SWYPFT a great place to work. What we try and do is balance those priorities between those particular objectives. So we have a focus on equality, diversity, inclusion, on the quality of service provision that we have, upon resources such as finance and IT, and with people. And we have 3 golden threads that run throughout everything that we do, and that's being a recovery-focused organisation and being trauma-informed. Recognising we have a very key role in each of our places in which we work, so we recognise our social responsibility and sustainability responsibilities, and absolutely pivotal is actually equality, involvement, diversity and inclusion. So they run through our organisation. So what I'll just touch on very briefly on the next couple of slides is what we've done as an organisation in meeting those objectives over the last year or so. And these are just, by the way, just a small number that we've picked out, and I could talk actually for quite a long time. 15 minutes for this presentation can't really do it justice, but I'm sure many of you are aware that we've been looking at transforming our older people's inpatient services, and we've conducted a very thorough and comprehensive and engaging consultation process across West Yorkshire. We've introduced something called Connecting People, which we really want to involve the communities in the design and delivery of our services, and we've been going live with that over the course of the last year. We've developed an all-of-you animation film that we've been sharing with staff, which is a very simple and basic animation, but really promotes and helps us understand the benefits of inclusivity in our workplace. Within our pharmacy and medicine management team, we've introduced electronic prescribing, which makes a real improvement in terms of safety of medicines prescribing. We really recognise the importance that carers play in the roles of our service users. And we've achieved something called the Triangle of Care Star 1, which is a real fillip for our organisation and good recognition that we're putting carers at the heart of what we do. And we've done a lot of work on personal care and support planning, and we've done some addition. Zahidas, who's just coming in at the back, has actually been laying on some additional training for equality, diversity and inclusion, which many of our managers have attended. So again, some really good examples of what we've done towards our objectives. On the next slide, I really hope I can be in this position next year and say the same, but we achieved all of our financial targets last year. It's getting more and more challenging. We've introduced something called Patient Knows Best, which basically enables people to access their own healthcare information in an easier format. We are in the middle of introducing digital dictation, so recognising the importance of actually how technology can improve what we do and make it more efficient and more effective. We've introduced, on a pilot basis, the use of e-bikes, particularly in Barnsley. From our great place to work, we actually did recognise, and I'll talk a little bit more about people and workforce towards the end of the presentation. We had vastly improved staff survey results last year, which I think is a real positive, again, for the organisation. We all know, I think every one of us that either is working or has worked in the past, if we all come to work motivated, we're going to do a better job. So that was really pleasing to see. We're not perfect, I'm not saying for 1 minute we are. We know we've got areas to work on, but it was positive to see some improvement. And as I mentioned earlier, we've actually had better recruitment over the last couple of years. And as an organisation, we have, my background, I worked in private sector for 20 years and I've worked in the NHS for about 15. The wellbeing offer we have here is actually second to none in terms of what I've experienced in my working life. So we do try and look after our staff as well as we can do. I'd like to move on to the next slide and just talk about celebrating success. And Marie and I regularly give a welcome speech to our new starters each month. And I'm very, very keen to say, you can look at numbers and you can talk about 98,000 people who actually receive care from us. I mean, that is a staggering number of people. But I think it's not about the number, it's about the people. So that is 98,000 people, many of whom are at the most vulnerable and in desperate need of care have actually benefited from our services. I always like to think about the people on the other side of the care rather than the number itself. But it's not just 98,000 people, it's their families, it's their carers, it's their loved ones, their friends who will also be benefiting from the care that we're providing. I actually could have had pages and pages of achievements actually, but I'm just going to give you a few examples. Our veteran aware service has been reaccredited, again very positive. We've been using virtual reality software. We're really big on actually promoting innovation, creativity and improvement, which I'll talk about in a few moments. Our services in Barnsley have been supporting young people that stammer with virtual reality software. Our early intervention and psychosis team has had national recognition. David Yockney, who's one of our nurses in Barnsley, has received the prestigious Queen's Nurse title. Julie Metcalf, another member of our staff, has actually been given a Gold Award for our services to disability sport. Our South Yorkshire Liaison and Diversion Service have received a Silver Lived Experience Charter status. Our perinatal peer support workers have won a national award, and our smoking cessation services that we provide 5 services across Yorkshire. They are the best performing 5 services across Yorkshire and Humber. So that's just a small, as I say, a small number of examples of, and I could have gone at length and talked about many more achievements than that. So I think it's really important on an occasion like this just to take a step back and recognising the huge efforts that our staff are putting in every day. And that actually all culminates, if I go on to the next slide, Andy, in what I think is one of the most inspiring evenings I attend every year, which is our Annual Excellence Awards. I won't talk too much about them. So the videos you've seen today are actually from teams that were nominated and shortlisted for those awards, which is why we want to share as many as we can with you. They're about a minute long, so that hopefully they'll give you a really good flavour of many of the different services and initiatives that we're taking. We had over 280 entries actually for the awards last year. Unfortunately, we can't recognise all 280 with winners, but on the same day we were able to actually have a celebration for all the people that have been through different learning and development opportunities with us, and recognise people that have got particular long service. We have long service awards for 25 years and 40 years, and it really is quite surprising how many people have actually worked in the NHS for 40 years or more, which I think is a huge testament to their commitment. So again, if we just move on, I will talk a little bit about creativity and health, just very briefly. I know time's of the essence now. We have a linked charity called Creative Minds, which works very closely with service users and other organisations, particularly across Calderdale, Caerclees and Wakefield. And it's about actually how we can work and actually introduce creative, therapies in addition or alternatively to what we're providing as part of their core service requirement. We have a mental health museum. Maybe I don't know if you'll get a chance to look at it today, but if you want to come back, it's really worth a visit. It's one of only 3 in the country. It's on the Fieldhead site, and I really would recommend people having a good look at that. And it's very inspiring. Again, it gives you a really good history of mental health. And the team there actually took it out on a roadshow this year. So really pleased to actually, I guess, expand where we share our mental health museum. Development of our positivity tree, we can see there, which was actually in one of our facilities at Lyndhurst in Calderdale. And to celebrate the NHS 75th anniversary, our charity AUP put on a number of events as well. So some really fantastic examples of how we use creativity to complement the services that we're providing. I should say we also have some fantastic recovery colleges which put on a number of courses in each of our places. So Andy, if you can just move on, I'll just talk a little bit. I thought it was a bit unfair to ask John to speak about what we've been doing on people. In fact, he only joined 2 weeks ago. So I'll cover the people workforce side of things. And it would be remiss of me not to say this, but I mean, when you look at us from a cost basis, 80% of our costs relate to people. We are a service organisation. We are dependent upon having really good people in our organisation who are motivated to do the right job, trained to do the right job, and enjoy coming to work. So we have a number of pledges that we've developed. These will be coming up for renewal in the next year or so, but we have pledges around staff wanting to feel safe, being supported, being fit and well, being able to develop their potential in the organisation, and knowing that their voice really counts and matters and they can make a difference. So just moving on, we can talk about what we've really been doing over the last year or so. As I said earlier, we've done some specific or additional training on equality, diversity and inclusion. We've also had actually sessions with our, what we call, I guess, our middle managers over the last few months, and part of that session has been focusing on inclusive leadership. We've done that with our extended leadership team as well. We've become a disability confident and carer confident employer. We've been doing a lot of work on developing new roles. We know that, I guess, the world is always changing, the workforce is changing. We've got to move with those times and actually develop new roles as the organisation progresses. We're working in close partnership with our staff side colleagues, and it's a really valuable relationship that we have with them. Mentioned earlier about recruitment, we've been taking some really innovative approaches to recruitment. There's not a single answer to it, but we've been holding local recruitment events. On one of the previous slides, it talked about having a recruitment day for estate staff in Barnsley. So we've done some really good work, and as I say, we've got more staff now than we had a year ago and 2 years ago. Our staff survey results were better. We talked a lot about well-being, and on occasions, many organisations, it can be quite a stressful experience coming to work. We don't want that to happen. We've got over 100 well-being champions that work within their teams, helping to support well-being of their colleagues. And we've got a strong occupational health office. So they're just some of the headlines. So I think that's about me just about to conclude. Other than the fact, I think on the last slide, all I want to do really is thank you for attending today. You don't have to come here, actually. What that demonstrates to me is you're really interested in your care. There are so many thank yous I need to make, but so I'll hope, apologies if I miss any out, but particularly thank you, as I said, to everybody who's come today to listen. Huge thank you, actually, to the people that feed back to us and give us the feedback that we need to help improving services and receive services from us. Huge thank you to all of our colleagues who are actually working day in, day out to provide the best possible care. Governors, board members, you have my personal thanks and gratitude for everything that you do. So everybody here, as I said, is caring, and I think together we are making a real difference to the people that we are serving. We can always get better, and we will always strive to do better. And I think when Dawn talks about our strategy, we'll talk about how we can improve. So thank you for listening. There's one more video that we're just going to show, which I can't even remember what it is, Andy, to be quite honest. But yeah. So Andy's going to show a video. Then I'm handing over to Amy, who's going to talk about our quality accounts.
The Health and Wellbeing Champions are all about raising awareness of the different services available for staff members and their wellbeing. There's over 100 Health and Wellbeing Champion volunteers.
It's giving people permission to prioritise their general wellbeing. You can't do a good job if you're not looking after yourself.
So the signposting might be thinking about the pastoral care, who provide a lot of support surrounding healers, meditation, mindfulness, staff wellbeing retreat, thinking about occupational health as well.
The outcomes are really noticeable to see within the team, like people are generally happier, they know they've got that safe space as well. By checking in with people daily, making sure that everyone's okay, recognising when people might have an issue. I've also created like a wellbeing board within the office, which is really nice, sort of acknowledging people's accomplishments. It's really important we look after ourselves so we can do the job that we're supposed to be doing.
There's been a bit of a shift in the culture surrounding wellbeing. It's making it a good place to work because we're really reacting to what people are wanting. A really big push was the wellbeing champion role. It has been really successful.
That's, if you encapsulate what Mark said, the wellbeing there, it's starting to be a lot better. So the next stage is quality accounts, and I know Amy, please be kind to Amy. She's our new Deputy Director, so Amy, on behalf of Darryl, I think would have been here. Over to you.
Thank you everybody, and it's lovely to see so many people here, and thank you to the people who are watching online. As Marie said, I'm new to the organisation. I'm still saying that 10 weeks in, so I feel a bit like I'm taking the credit with this presentation for work that hasn't necessarily been done by me, but it is by all of the team and everybody who works within our services. So our quality priorities for 2023-24 were around safe and responsive care, equality, inclusion and equity for both staff and service users in the communities we serve, and health, wellbeing and experience of staff. And these, again, as Mark said in his presentation, are just a few examples of some of the work that's been done underneath each of those quality priorities. So we've done lots of work around ligature risk awareness, There's been national work led by the National Forum for Mental Health and Learning Disability Nurse Directors and the CQC around actually what does really good standards around minimising ligature harm look like. So we're working towards making sure that we've embedded all of that best practice. The move to EPMA and the move to EPMA as Mark mentioned, and looking at work around our clinical record keeping as well, and our learning disability services, again recognising that people with learning disabilities face some of the biggest health challenges in our communities. In terms of equality, inclusion and equity, we've been looking at embedding a trauma-informed approach, and with that work will continue in the next year. Our children's speech and language team with the stammering app and the virtual reality work, and lots of work that we've done around falls improvement as well, recognising the significant health complications that can be brought on by a fall for a large proportion of our service users. And in the health and wellbeing experience of staff, you'll see later on that our staff survey has improved, and while we still strive to improve those scores further, that's really positive that we're moving in the right direction. We continue to offer that and improve that staff wellbeing offer. Learning from incidents, we've recently moved away during this previous year from the serious incident framework that's been used within the NHS for a number of years to a new model of reporting incidents that focuses more on local learning and on local ownership, and actually how that drives improvements in services. We've also been engaging with staff through our Tea for Quality sessions. So those sit within the Nursing Quality and Professions Directorate, and that's about us as a team, particularly me, getting out and meeting that teams firsthand and getting to have conversations with teams about what's really important to them and what we can support them with, or where we can look at improvements that will help them to deliver the best standards of care. So our approach to quality, we use five main drivers. So that's around strengthening our quality management system. It's around improving the use of data. We need to make sure that what we're doing is working, and what seems like a good idea may not necessarily be the right idea. So we need to be using data to inform our improvements. Building capacity and capability for improvement, so encouraging all of the people who use our services, families and carers, staff who work across our services, to all be involved in that journey. And ensuring planning is service-centred and it's holistic, so we look at the whole person. And also a culture of self-development and learning, and that systematic delivery of that, so that we can be really assured that good practice, innovative practice, people who are going the extra mile, that's shared across our services, as in Mark's presentation earlier when he showed the kind of map of the area that we cover. It's a huge geographical area, and actually what we want to make sure is that no matter where you touch with our services, you get the same excellent standard of care, and that innovation and good practice is shared. Then we have our quality governance structures. So again, I think it's really important about that. How does that learning and that information, how does it come up and how does it come back down? And so that's a two-way communication. So that's through our care group governance groups, that then goes into our trust-wide clinical governance group, that then goes into our quality and safety committee, and from there to board, and then back down again. So it's that really clear pathway for communication and sharing of learning. And this is just a short video, as Mark said, and Marie, there's going to be videos throughout, I think, the afternoon. So this is one that's just talking about one of our teams that's been set up. And again, it's that the use of data to inform what local communities need.
The psychosocial engagement team, in essence, were a suicide prevention team. The PET team was set up in 2021. It initially ran as a pilot. The primary purpose of the service was to try and reduce the suicide rates in Barnsley. From real-time surveillance data provided by Barnsley Public Health, it's shown that there has been a reduction in suicide in Barnsley, and would like to think that we've played a role in that.
I was a service user with the PET team in July 2021 and worked with them for 6 weeks in intensive intervention. Was seeing someone every week. It was me unburdening what was going on in my head, working through things, having that other person there to talk to and listen, and also to offer suggestions and advice and hope. Hope's a massive thing for recovery, and they provided that. They gave me the idea that there could be a future.
I'm extremely proud of the service and what we do. I think it's the most fulfilling role I've ever had in my career. We often meet people at the most vulnerable and the worst time in their life, and to see somebody work really hard to get through that and make them positive changing is just the best thing.
And I think you'll probably agree that's a fantastic, innovative service, and actually the data that sits behind that shows that suicide rates have decreased since that service went live. And that is, I know we touched on it earlier, that's not only that person who's still alive and still with us, but actually their family, their friends, their neighbours, their colleagues, the people who love and care about them. That has an impact on so many lives. So that's an example of an absolutely fantastic service. As many of you will be aware, we had a visit from the Care Quality Commission in May 2023, and they undertook 2 unannounced inspections looking at across our adult inpatient wards, our psychiatric intensive care units and our forensic services. They visited 9 acute or psychiatric intensive care units and 9 forensic inpatient wards. Both of those services received a requires improvement rating followed those visits. The Trust retained its overall good, and I think it's safe to say even in the short time I've been with SWYPFT, I've seen the work that's going on around the musts and the should-dos that have come out of that inspection. So obviously this is just picking out a few of the kind of the learning that's come out of those visits. So improvements were needed in the monitoring of service users after they've had emergency medication or while in seclusion. And I think it's really important that we recognise that actually the medication that we give to people, often when they're at their most distressed and they're most unwell, can have really serious physical side effects. And so it's that monitoring of people is really important. The people we care for in seclusion are our poorest and most vulnerable patients. Seclusion is our intensive care unit. It's, and again, that monitoring of people in a holistic way that not only is looking after their mental health, but monitoring their physical health as well is really important. So there've been significant improvements in terms of looking at how we monitor that and how we support clinical teams doing the day job to do that, to make doing the right thing the easiest thing to do, and to make sure that we can evidence that and we support them in that. Following the inspections, both care groups have developed their own action plans. I think it's really important that actually it's staff at the front line and it's the care groups that own those actions, and it's something that they've developed themselves, and they see the benefits of those improvements and they understand why, rather than it being a top-down approach. In terms of there's been support for that from the care group senior leadership teams, from the chief nurse and the nursing quality and professions team around supporting those care groups in how we monitor those improvements and make sure they've got the resources and the capacity they need to be able to embed those in practice. As I mentioned earlier, obviously quality is a top priority for us, and our friends and family tests are rated as either good or very good. And while that is a moment in time for people, it's a really important broad indicator of where we are, and it's really pleasing to see that increase across our community services and our mental health services, and that giving that trust-wide increase as well. Obviously we are striving to continue to improve that. It's not about resting on our laurels, it's a continuous improvement programme, but it's pleasing to see that we're going in the right direction. And here's just picked out again a few of the key targets that we're held to account for. So 88.7% of people experiencing a first episode of psychosis were treated within 2 weeks of referral. And again, when you think about the impact upon families, loved ones, communities, that's really important that people are seen in a really timely way. We also know that by engaging with people quickly in a first episode of psychosis, we can dramatically improve long-term outcomes as well. Oh, sorry, can I just go back? Oh, sorry. 4.3% of people were readmitted within 28 days of discharge. And again, we've got lots of work going on about, we know that it's better for people to be cared for closer to home, wherever possible, and it's safe and it's clinically sound to do it. It's better to treat people at home in their communities because that's where recovery sits. So we only want people coming into hospital if that is absolutely the best place for them to be. You know, we don't want people in hospital missing family birthdays, important occasions, time spent with loved ones, doing the activities they enjoy. But actually a really good kind of balance to that is looking at the number of people who are readmitted within 28 days of discharge, because if that number was significantly improving, that would be telling us that we perhaps tipped the balance a bit too far and we needed to look again at what we were doing. Again, it's that use of data to inform things. So keeping it below 5% is a good indicator that our work is going in the right way. And 98.8% of people awaiting admission to acute wards had the crisis home resolution team working with them as a gatekeeper whilst they were waiting for admission. Because again, where we do think admission's appropriate, it's really, really important while a bed is being sourced that we provide that really intensive wraparound support to both the person and the people who love and care for them. We met key targets around NHS talking therapies as well, that 98.7% of referrals had a waiting time for treatment of less than 6 weeks. And again, there's been lots of stuff in the news over the last couple of weeks about the need for the NHS to work upstream with people, and we know that if people have access to talking therapies in a timely way, it can prevent that deterioration in their mental health and prevent the need to come into other services for longer term interventions. 99.8% of referrals had a waiting time for treatment of less than 18 weeks, and 52.3% of service users moved to recovery after intervention from talking therapies. I think now I just have one last video to show. So this is another video that talks with one of our clinical teams, and this is around a team that does some really important work in forensic services around managing substance use. And again, it's easy to think that it's about looking at the holistic person, somebody who's in forensic services who has limited access to the community, potentially limited access to illicit substances or alcohol. That's not to say that people don't try. We can't say we 100% stop it because prisons can't, so we definitely can't in hospitals all the time. So it's about that, working with people on the reasons why they use substances or use alcohol, working with people on plans around what's going to be different when they go home, when they move out of those secure services, and actually preparing people for a life after an inpatient admission and for recovery, and understanding that, you know, there's a lot of psychosocial interventions that need to sit behind that remaining in recovery when it comes to alcohol or substances. So starting that journey in inpatients is a really innovative approach for forensic services. So I'll leave you with this last video.
The Forensic Substance Misuse team, we screen and assess patients for the historical substance misuse. We offer interventions tailored to their goals.
We do work with mentally disordered offenders within the forensic BDU. Patients are really keen to attend their sessions on a weekly basis. Some of them have reduced their drug intake, and most of them have stopped taking substances.
Change comes gradually for a lot of people, and it's seen those small changes grow into bigger changes that can be really rewarding.
We've started with helping all the service users to have Hep C vaccinations. We've recently started teaching naloxone administration to all the staff because I think it's something that we've realized that there was a knowledge gap. So we've taken an initiative on that, and I think it's been received greatly. Personally, I find it very rewarding. I think it just gives you that sense of achievement to say you've done something good for the next person. That's why I came into nursing in the first place.
So I want to sit over here. So my job is to keep introducing people. So thank you for that, Amy. I think it was a great oversight to the quality of care we provide in the trust. I'm now going to hand over to Adrian. They always say finance. Well, over to Adrian. As exciting as possible as it is, but I'm sure it'll be a lovely presentation. Thank you, Adrian.
Thanks for the intro, Marie. So I'm Adrian Snarr. Director of Finance and Resources, and I know I'm the reason you're all here today. So there's a level of formality of, as Marie said in the introduction, we're obliged to have an annual members meeting, so we'll go through the formality, but hopefully in terms of what did we spend and where, you can start to see the links through into what Mark said about where our priorities are, particularly around staffing. So we'll just go through and say we'll take some questions at the end if there are any. So we are required to submit our draft accounts by prescribed deadline early in April. So less than a month after the end of the financial year, we send our draft accounts off. We hit that deadline. We then make them available for scrutiny, both through our regulator route, but predominantly through our external auditors. So the first thing that we get assurance on is our internal audit process, who's been looking at our systems and processes throughout the year. They will give a final year-end view as to whether they've observed good control or there's anything they're concerned about. So we've got significant assurance from our internal audit team. We've always got positive feedback in terms of our control environment, and this year was no different. So we've got a good, clean head of internal audit opinion there. External audit, they focus very much more on the accounts and to some extent the content of the annual report, but predominantly the accounts. So they've given us good assurance and an unmodified opinion. So that's audit speak for they haven't found any issues that they want to flag. So they haven't asked us to change the accounts, they haven't found any significant or material errors in the accounts, and therefore they give it a good assurance rating. As part of that feedback process, we asked the external auditors to present to members, and they did that just recently at Members' Council on the 13th of September. So again, members had an opportunity to ask our auditors questions or ask me questions on the content of the accounts. We spend a bit of time at our audit committee. So our audit committee is chaired by an accountant who therefore has some of the requisite skills and certainly the knowledge to interpret accounts and ask questions. So we spend a bit of time going through that committee, looking at the accounts. I present them, the external audit present their view, and then ultimately we sign them off, or we ask the trust board to approve them and sign them off. And then they are submitted nationally for collation with all other NHS trusts and NHS Foundation trusts, so that the overall NHS position can be finalised and published on behalf of government. So we hit that deadline as well. So we did everything that was asked of us. We had no concerns raised by our external scrutiny in those accounts, so that's good. That's something I always need to achieve in my professional accountability role, but it's also great for the organisation. Thank you, Andy. So we always like to compare one year with the other. So this is the feedback on 23-24, but we'll just share with you the figures from 22-23, so you can just see what's changed, and I'll just give a little bit of an explanation as to why some of those figures have changed. So income has gone up, expenditure has gone up, and surplus has gone down. So we'll explore that in a little bit more detail when we go through the slides. But as Mark said at the beginning, we've had much more success in recruiting staff. So in 22-23, although we delivered a very healthy surplus, we'd actually liked it to have been a bit lower, and we would have liked to have recruited more staff. But we started to see staff recruitment really take off in 23-24. Hence, we moved to a lower level of surplus and closer to a break-even point. Next slide, if you could, Andy. So anybody who looks at our board reports will see we have a regular reporting methodology where there's a number of KPIs we look at. This isn't all of them that you'd see in the board report, but these are some of the significant ones. So the overarching aim is we need to be as break-even or better. So we either need to break even, i.e. we spend the income that we've got in totality, or we deliver a surplus. We should not overspend our resources and tip into deficit. So you can see the numbers from this slide to the previous one are slightly different because we take out some technical aspects, which is called impairment of assets. But this shows kind of the real position, if you like. So the real surplus was about 3 million, and then in 23-24 that dropped down to about 500,000. But nevertheless, it's still a surplus. Part of that successful staff recruitment means we've got less reliance on agency staff. So again, comparing 2 years, we spent 10 million in 22-23 on agency staff, and we were actually planning to reduce that anyway, but we exceeded that plan. So we actually spent about 8.3 million on agency staff. And if you look at the in-year position for 24-25, we've managed to hold that position. So it's not going down as fast as it was, but it's certainly not going back up. So we're quite pleased that we are reducing our reliance on external agency staff. Cash is a key headline indicator for any of you that sort of work outside the public sector and work in private organisations or run your own businesses. You've got to have enough cash to keep trading. Well, the basic principle is the same for the NHS. We've got to make sure that we are solvent and we have enough cash in the bank to meet all our obligations. It is going down, and it is going down because we're not delivering surpluses at the same rate as we were, but that cash position is still relatively healthy if you compare it to peer organisations across the NHS. It is something we are putting more focus into as we go into the new financial year, because it is still continuing to decrease because we don't have the financial headroom we used to have, but it's certainly not in the range where we would have any concerns at this point in time. And then the final indicator there is capital expenditure. So we got slightly more capital in 23-24 than we had in previous years. We plan to fully utilise it, so we plan to spend the 8.3 million that was available, and we did. So predominantly that gets spent on infrastructure, the buildings, and maintaining the buildings, or on technology, so maintaining our IT infrastructures in the main. So we do spend more on buildings than on technology. We do continually test ourselves, see whether that split is the right split or not, but we also make sure that we fully utilise the funds that are available to us in every year. And that's what we did in 23-24. Thank you, Andy. So just a little bit more detail on some of the income and expenditure lines. So income went up by 4.9%. Predominantly that's because our contracts are increased for inflation. So most of that increase was an inflationary uplift to our contract baseline. We still had a partial full year effect of provider collaboratives. So we are the lead for adult secure collaboratives in West Yorkshire and South Yorkshire. South Yorkshire one started later, so we got a 4-year impact feeding through into 23-24. But we also are still getting uplifts for the mental health investment standard. So the government has set a target that says investment in mental health should be at a higher rate than general NHS inflation, which means our local place-based commissioners look at new initiatives, some of which Mark mentioned in his introductory session. They look at those new initiatives and they fund us for them, and that comes through as an increase to our income as well. Thank you, Andy. So pay and non-pay are the two significant headings that we track all our expenditure against. As a mental health trust, mental health community trust, we're probably about 80% pay, 20% non-pay, broadly speaking. So pay's gone up a significant amount, but there was a pay award that went through in that year. So we will see pay go up for the pay award, for incremental increases under the agenda for change, but also because our headcount's gone up. So I'm not sharing any headcount figures today, but you will see that our substantive staff numbers have been increasing year on year, and that's a real positive for the reasons that Mark cited earlier. From a financial point of view, we're moving from that fairly significant surplus in 22-23. It's reduced in 23-24, and if we look into this year, it reduces further again. And that's not the only reason, but it's predominantly because we are still seeing staffing numbers increasing. So we're getting to the point now where we need to make sure that we can balance the money with the headcount and make sure that we've got a robust plan, that we are targeting our recruitment. Whereas a couple of years ago, we knew that we needed to increase our staffing numbers in most areas, and that's what we've done. Non-pay has increased by 10 million, but I'll come on to that in the next slide because we break it down a little bit. Depreciation is a sort of technical figure. That's just a calculation based on our asset value. So our buildings have a value, and we apply a percentage to that, and we charge depreciation. That creates our investment fund, if you like, for maintaining those buildings as we go forward. But you can see that's gone up, and it's predominantly gone up because building values go up in the main. and impairments is a technical change to that asset base as well. So you can see, you can sort of track through why we've got that increase in expenditure. But I'll just break down the non-pay a little bit on the next slide, Andy. Oh, sorry, staffing first. So you can see there in financial terms, substantive trust staff cost has gone up for the reasons I cited earlier. Bank locum costs have also gone up, so we still are placing quite a high reliance on temporary staffing, but it's temporary bank staffing, and we've been able to reduce temporary agency staffing. So agency staffing is going down, but bank staffing is going up. That doesn't necessarily mean it collates service line by service line. That's the trust-wide position, so we do see some variability within the trust. Next slide, if you could, Andy. So this is the breakdown of non-pay. So pretty much without exception, you can see that the non-pay spend categories have all increased. Predominantly that's inflation. So 23-24 was the year where we started to see some fairly significant inflationary uplifts on a lot of our contract lines, and you can see that feeding through into the figures there. The single biggest expenditure line is healthcare provision, which is what I just mentioned about the adult secure collaboratives. So we get income in, but we spend that with other health bodies to provide forensic services. So it gets counted as non-pay because we're paying another NHS body. But you can see there that's where the biggest changes are, with the sort of just over 6 million increase on that line. Thanks, Andy. Mentioned the capital programme, that we fully utilise the funds that are available to us. There's limited opportunity to carry capital funding forward. So it's really important that when we set a plan, we've got confidence in the delivery. The really big challenge with capital, particularly on the estates and the build side, is there's quite long lead-in times to get schemes developed, up and running and delivered. And we've got to make sure that we allow some flex in the year for slippage on schemes. Can we bring other things forward? But we also need to make sure that we've got some opportunity to change the scope if in-year pressures hit us that we weren't predicting. So, for example, in 23-24, we were experiencing fairly significant damage to our seclusion rooms. So we had to change some of our schemes around to make sure that we could maintain and improve those seclusion rooms and flex the capital programme accordingly. But it's really important we don't get drawn into spending all of the capital on buildings and not allowing enough investment in technology, because we've got to make sure we've got the good IT systems and infrastructure systems that support that. And again, Mark mentioned earlier, you know, the use of technology in some service areas that sometimes have a capital ask to get them up and running. So that was the trust position. Just briefly on the charity. And we've got a few examples of spend schemes that the charity have supported. It's really important to remember that the charity is not a top up to the trust. The charity should be doing things that we can't do as a trust, but partly because we're not empowered to use NHS funds for it. It shouldn't be a case of we can't afford it, so we get the charity to do it. So hopefully you can see from the examples that are given there that the trust charity is able to offer additional things over and above what you'd expect from standard NHS provision. We've got a really successful charity, segregated into some very key areas, and they have different focuses across those charities. In terms of the numbers, you can see that the income's significantly down. In part, that is because the trust was able to support the charity, and it's increasingly challenges for us to do that as a trust. But I think you will see in lots of charitable organisations, donations are down. I was at a meeting yesterday with hospices, and they're really struggling because across the whole charitable sector, people aren't donating in the way that they used to, either before COVID or before the cost of living crisis, or a bit of both, actually. So we really do value the charity, and we really do know that it adds some really great opportunities for our service users and staff. So I'm just going to finish with a short video on the one aspect of the charity, which is the Mental Health Museum.
The Mental Health Museum begun in the 1970s, and it was a secretary to the Stanley Royd Hospital at the time who was really interested in collecting some of the objects that told the history of the treatment of mental health. But really one of the joys has been coming out into this space and seeing the museum expand beyond its walls and seeing how we can link some of those themes about the past, about the therapeutic use of space and enjoying a green community.
Our green year actually came into existence just in COVID times really. So what we did is actually sort of sent out some seed packets to grow along project. So it started off from there, and it is about actually sort of looking at the green space that we have on the site. We actually sort of have sort of Grow Wakefield here as well as a partner, and it's actually sort of getting service users involved in more activities on the site as well, because we do actually have a fantastic resource that we could use.
It's been really successful, I think. It's been successful for the team in looking at how our practices and how we can use some of this fantastic space. We've sent out lots of our resources into the community. We started to develop those programmes for years ahead as well, so it's not just going to be our green year, it's going to be our green decade.
Thank you, Adrian, and I'm sure you'll agree, financially I think that was an excellent overview of the financial accounts, and I have to say, for non-finances in the room, I think it made it very simple because it can often confuse people, so thank you, Adrian, for that. I'm going to move on now to one of the most special people in my life as our lead governor, and without further ado, John, over to you. Thank you.
Thank you, Marie. What an intro. Right, just give me a minute to get my stall set up. Your tape's come unstuck again.
Is it okay?
Is it okay?
Yeah, we're okay, John.
Right. Okay. Hello. I'm John Laville, and I am publicly elected governor for Kirklees. And I've been lead governor now for 5 years, and I'm absolutely privileged to be lead governor. So in the next 20 minutes or so, I'm going to take you through what we've achieved in the past year, an update on the commitments that I made last year at the Al Hikma Centre in this meeting, and what our plans are for next year. So next slide, Andy. So you've seen this map before. As Mark said, we cover a very large area, 556 square miles to be precise. From Cornholme in the far west of Calderdale to Nottingley in the far east of Wakefield, from Thurgerland in the south of Barnsley to Birkenshaw in the north of Kirklees. And if you added those numbers up, it comes to 1.2 million people. And we have, as you'll see in a slide or two, 18 public governors. And if you work the numbers out, that's 66,000 people per public governor. So the public governors have quite a job on to represent their communities. However, that is their role, to get intelligence and insight from the communities and then feed them back into the trust. So, a big catchment area. Let's move on to the next slide where we show our membership numbers. So, last year we said, and this year we still want to increase our number of members. And you can see from the numbers there in terms of our public governors, in terms of our public members, the number is fairly static. Does that mean that everybody who was a member of the trust last year is a member of the trust this year? No, there's a constant turnover, but overall our membership numbers in terms of public are flat. In terms of our staff members, they have gone up by 300, which is 7.5%, so that's a good increase. In terms of participation in elections, so all public members can vote in the elections for their governors in their specific areas. In terms of our public participation, it was 3.5%, which is pretty rubbish if we're honest. And in terms of staff participation in elections, it was 18%, which is sort of fairly creditable. And obviously, we are looking at ways all the time to publicise what the trust does, what it means to be a member, what it means to be a governor. And in the last 12 months, I'm pleased to say that we have released a governor's video, and it's not as short as the other ones, but we'll watch it now.
Hello, my name is Keith Stewart Clark.
Hello, my name's Bob Clayton.
Hi, my name's Ramesa.
Hello, my name is John Laville.
I'm a publicly elected governor for the South West Yorkshire Partnership NHS Trust.
And I'm a publicly elected governor for Barnsley.
And I am a council member at South West Yorkshire Partnership and Foundation Trust.
I am publicly elected governor for Kirklees, and I am lead governor.
Well, the role of a council member is really to be the eyes and the ears of the general public.
There are three specific groups in the Members' Council. One is that of appointed governors, and they are appointed from our partner organisations, the acute trusts, the councils, in the areas that we work. The second group is staff, and again, they represent the different sectors within the staff area, within the 4,500 people who work for the trust. And then the third sector is publicly elected governors, so those are from 5 areas which are sort of the geographic council boundaries, Barnsley, Wakefield, Calderdale, Kirklees, and the rest of Yorkshire and neighbouring counties.
They all have a different view of what the trust is and what the trust should do.
I became a council member because as a young member in society, I think that it's important to have our voice heard.
I'm a council member because I'm a nosy person and I want to help people.
I became a council member because I'm really interested in the way that mental health is dealt with, and also that I'm very keen on art and culture. I really wanted to say how that was represented in the way the trust works.
Well, I became a council member through personal experience. So I have had and have family members and friends who are service users and carers for service users in the trust. And I wanted to use my experience, which is all outside the NHS, and see if I could bring that into the trust and hopefully using the intelligence from my local community, bring that feedback into the trust and hopefully improve some of the aspects of trust working.
As council members, we bring our own life experiences from where we live, and our different cultures all come together to make sure we have a collective understanding of each other.
Who would make a good council member? Anybody would make a good council member. They really would. You have to want to do it, and you have to be prepared to put some effort in to get something out.
The best thing about being a council member is that you use your knowledge and you help people, and you know that people listen to you and they listen to your experiences, and it's like being part of a family. It's quite simple to become a council member in terms of a staff member or a publicly elected member. You simply self-nominate, and then we go through an independent election process of the members in that area. So in my particular case of Kirklees, the members in Kirklees voted in the election, which I was successful.
You get to know a lot about what's happening within the NHS, and as a governor I've been involved in how that is developing and perhaps being able to influence the passage of that so that it helps people with mental health problems.
There's a number of different roles within the council. Once elected, council members are encouraged to apply to these to bring their own skill sets to the trust.
Oh, the best thing about being a council member, I think, is the fact that you have a real influence for the better on the way that the trust has provided its services.
If you're considering being a council member, I would look into it as much as possible, and then when the time comes and you're invited to apply as the governor, apply.
Well, how can people find out more? I mean, the standard answer is go to the website, or you can just follow the link on this video.
Okay, I think I'm better in person than on film, but anyway, you can be the judge. So as a few speakers have said, we have got some statutory obligations at this meeting. One of those is to go through in a bit more detail what I went through on the video, and that is the makeup of our members' council. As you can see on the chart there, we have 18 public governors, and they are made up from the council areas, and the number in each area is based on the population. So we've got 3 in Calderdale, 3 in Barnsley, 6 in Kirklees and 5 in Wakefield, and 1 in the rest of Yorkshire and neighbouring counties. Then we have a group of appointed governors, and they are appointed from our partner organisations, so the 4 councils, Barnsley, Calderdale, Wakefield and Kirklees. 3 appointed governors from our acute trusts, Barnsley, Mid-Yorkshire, Mid-Yorks and Calderdale and Huddersfield. 1 appointed governor from our staff side organisations, and 1 governor from our partner university, which is the University of Huddersfield. We then have 7 staff governors from the different disciplines, nursing, allied health professionals, social workers, etc. So that is the makeup of the members' council. There's 34 in total. It's ever changing because some governors stand down, they come to the end of their term, but I'm really pleased to say that as of the 1st of November, when some elections that are rolling through at the moment come to pass, we will have 33 out of 34 governors appointed. So that's really good. But who are these governors? So are they special people that been moulded in a certain way, and they're sort of a bit like automatons, if I could say the word? Well, here's a few photos of some of our governors. So to sort of demonstrate what our governors are like and what sort of backgrounds they have, we asked each governor to describe themselves in 3 words or 3 short terms. So the next slide says what some of the public governors describe themselves as. So young, older, working, retired, students, singers, music lovers. Some were even very specific and said they were Rolling Stones fans. So carers, service users, advocates, sporty types, joggers. Some even were again very specific and said that they were Huddersfield Town fans. Somebody has to be. Dead right, John. Somebody has to be. The odd Huddersfield Town fan. Some would say that you have to be odd to be an Huddersfield Town fan. Some come from far afield and were born outside the county, but lots are Yorkshire people. So that's sort of some of our public governors now that describe themselves. So what about our appointed and staff governors? They must have a special, they must be special. Well, they describe themselves as mums and wives and grandmas and nurses and managers and guitarists and gardeners, sports enthusiasts. We've even got one governor who is a sports presenter in his spare time on Saturday afternoons. We've got one governor who is an ex-international hockey player. We've got lots of lovers, cat lovers, book lovers, sun lovers, even Costa lovers. Other coffee brands are available. So they're all different. They're all different. But they're all the same in one respect. They give their time freely to try and help our trust improve so it can improve its services to our service users, the carers and our partners. So we're all different, but we're all the same in that one respect. So we'll move on now to what the Members' Council has achieved in the past year. So we've been publicising ourselves. So we've been at events. We've now got a web page on the Trust website. We've done the video. So we've been publicising ourselves and what we do. We've been inspecting. Part of the role of the governors is to inspect or help inspect our services, be that inpatient or in the community. So we have different types of visits. We have quality monitoring visits. We have place visits, which are patient-led assessment of the care environment. And we've got a new type of visit, which is a quality oversight and monitoring. And governors have played a really active role in those visits. We've been involving, so we've been involving ourselves in consultations, particularly the older people services transformation, where there's been a massive governor input into all the public consultations. We've been improving, so we're always looking to improve the Members' Council and how we can make it more accessible, because as you've seen, we've got a wider range of governors, and one size doesn't fit all. So if we're having a meeting at 10 o'clock on a morning, then if students are at college, they're not going to be able to attend that. So we're trying to make it as accessible as possible and improving the way we work. We've been updating governor training. We've been selecting. So as Mark said, we've just selected 2 new non-exec directors. We also agree on reappointments, and I'm delighted to say we have reappointed Marie for a further 3-year term from December. We've been developing, and this time last year I talked about we need to hear more from our young people. So we've been developing links with our young people. We had a fantastic workshop with Young Lives Wakefield just after Easter. We had a major presence at the UK Youth Parliament in Doncaster a few weeks ago. So we are developing those links with young people. And we're supporting the events that the Trust runs, well-being fairs, many of us run carer groups, etc. So we're supporting the work of the Trust. So overall, I think we've executives present to the Members' Council the various reports. We have 8 Trust board meetings a year where governors will be always present, and have been over the last few Trust board meetings. We have 12 question and answer sessions a year with Marie, Mark and the chair of a specific board committee, and we can observe board committee meetings. So we can sit and watch the non-execs in action, and basically, are they holding the execs to account? Are they adding value to the decisions? Are they making sure that smart action's coming out of the meetings? And because we can now observe those, we can form a judgment and say, yes, are the non-execs working with the executive team, and is the board overall doing the right things? So moving on to our objectives last year and this year, so the 23 to 25, so we're in the middle of them. What have we done and what are we still to do? Well, the colour coding, if it's green, it means it's good. We're doing what we should do, and we'll continue to. If it's amber, then we're in progress, and if it's blue, well, we're starting, or it's not yet due. So, in terms of more members, no, sorry, Andy, jumping the gun. I know I'm going on, but I've got a couple of slides yet. So, in terms of increasing members, public members, as I've shown, we've not yet done that. However, Emily from Young Lives Wakefield, I don't know if she's in the meeting still, said to me this morning in the marketplace that people do not understand the value of being a member. And I think I will take that away and we will work on that. So if you're a member, you're not just a service user or a carer or a patient. You are part of the trust. You can have an influence on what the trust does. So yes, we want more members, and we will use that and move forward. We want people to know their governor, so if there are any issues, then they can get in touch with the governor. We're rolling out NHS email addresses for all governors, so that we will publicise those on the website and through our newsletter, and therefore people will be able to have better access to the governor. In terms of young people's forums, I've already mentioned this. We had a terrific workshop with Young Lives Wakefield and a really good input to the Youth Parliament in Doncaster some weeks ago. Health inequalities, part of the Trust's objectives is to reduce health inequalities, and we are helping the Trust to have a deeper dive. One or two specific governors are helping the Trust to have a deeper dive into some of the harder to reach areas. Triangle of care, we the Trust, and when I say we, and all these things that I'm talking about wouldn't be possible with just the governors themselves. It's only possible because we work so well with the Trust, and particularly I thank the corporate governance team because of the work that they do and how they support us. So just on the triangle of care, the governors have got to play their part, and Gillian's here, she leads triangle of care. As Mark said, we've got our first star, which enables us to move forward. It's a national accreditation, and the triangle is the clinician, the service user and the carer, and how those three work together. So we've got our first star for our inpatient work, and in year 2 we are moving on to the community work, and that is where governors can play an even bigger part. So in terms of quality, we've got lots of greens there. So one of the Trust values is to be transparent, and we are happy in terms of how the Trust is transparent about its quality, the good things, the not so good things, training, visits, Q&A sessions, I've mentioned them all. In terms of getting more integration with the integrated care system colleagues, we've still got to work on that. We're not doing as well on that as we need to. In terms of effectiveness, holding the non-execs to account, I've mentioned observing board committees, governor induction programme, staff governors creating their own networks, so that, because if I'm a staff governor, I might work here at Field Head, but I'm representing people who work in the Dales unit in Calderdale or in Kendray or in Kirklees. So how do I know what the issues are in those areas? Well, our staff governors are now creating their own sort of mini networks so they can just understand that. And we had a meeting, a virtual staff governor meeting last week where Elaine, who was sat here, and Leonie were telling, who covers the non-clinical staff, were telling us about their plans to just have more ears on the ground, basically. So that's in progress, and that's moving. So last year at the Al Hikma Centre, I made certain commitments to to members, and we'll just look at that. So last year, members could vote in the elections, and they still can, but they don't, as we've seen, and we need to change that. Members could participate in services and service design, and through the Older People's Transformation consultation, that has gone forward immensely. So that's a real improvement in that participation, and also participation in our trust strategy refresh, which Dawn's going to cover in a minute or two. We said we would have a newsletter. We said we'd publish it every 6 months. We've got a newsletter. We're publishing it every 3 months, so we're better than what we committed. It's only going out digitally at the moment because basically the cost will be prohibitive to send that out in terms of on paper, but we've got that newsletter and it's going to thousands of our members. In terms of governors, I've talked about Know Your Governor and SWYPFT email addresses, etc. So that is happening. I said we'd get better access to governors. That is happening. In terms of attending public meetings, well, governors have been at public meetings all over the shop, really. Wakefield, Hemsworth, Hebden Bridge, Halifax, Dewsbury Hospital, Huddersfield. We have supported the trust in attending public meetings. And developing young people's forums, I've already covered what we've been doing in that area. So, finally, your Members' Council is proud of its achievements. It's proud of the trust and the values. It's proud to serve its members, and it's proud of our plans going forward. So thanks for your attention, and we're now going to watch a short video about how the trust is enabling communities in Kirklees to come together. So thank you.
The Kirklees Tackling Health Inequalities project is a project where we support community groups to create and elevate some of the creative interventions for people within their community. Kirklees is a very diverse and quite a deprived community where people have faced challenges in accessing healthcare. Our aim is to try and support people to live well in their community through these community groups that they can attend. We've got yoga classes that we run, walking groups, arts and crafts groups. We've got the Meet and Mend project.
Meet and Mend is about empowering people to kind of either improve their lives or the lives of others. Some of the projects that we've done is a quilt project. We made quilts out of repurposed sort of materials. They were given to people that needed them for extra warmth. His current project is making blankets for people with dementia or sensory loss. Those are going to be donated to local charities and the hospitals who have dementia patients.
To be able to join in with a group, meeting new people, doing the favourite thing, sewing,
It's just a great thing to do, to know that we're helping other people.
It's wonderful that we've been recognised for the hard work that we're doing, engaging with community groups, just trying to improve healthcare, which is the most important thing.
Indeed, John. And now in terms of our strategy refresh, Dawn, and the future, over to you.
Thank you, Marie. It's a real pleasure to stand here to be able to talk about and launch our strategy refresh, particularly in the week that is my 1-year anniversary with SWYPFT. So it's nice to have been here a year and see something tangible. So really delighted to talk about our strategy refresh. And you notice I say it's our strategy refresh. So it's not mine, it is ours. We are all of us in mind, and that's really important to us. Mark talked about the privilege that it is to lead in the NHS and in SWYPFT in particular. And one of the most powerful things you can do as a leader is to listen and to give voice to others. And when we embarked on our strategy refresh, that's something we were really clear that we wanted to do. We wanted to listen, but we wanted to hear and to listen. We've heard about health inequalities in all the presentations and some of the wonderful work that we've got. And I would say we don't have hard to reach communities. We have those that are easy to ignore if we're not very careful. So my first video is Kath explaining to us why it's really important to hear different voice.
As a free supply worker, I think it's valuable for everyone to have their say. Get people's voices heard. Mine as well as a free supply worker. I try to speak up for people who cannot speak for themselves, to help them, support them, and prepare things in easy read, accessible for people. So that's my point across, as my view. And treat people equally. And just to have voices heard more than anything else, like co-production. As well as I am a peer leader myself for Wakefield. It's all about getting your views right as well.
Thanks, Andy. So one of the things that Kath did for us as one of our peer support workers was to engage with people with learning disabilities to help us understand and hear their views and their voice in a way that we could easily overlook if we're not really careful. So what I hope that gives you is a sense that we really wanted to approach our strategy refresh in an inclusive way. It's one thing to say you're inclusive, it's another thing to be that, but we were really committed that we wanted to take the time to do that. So we created our All of Us conversation, and that was an opportunity to engage with our colleagues and our communities about their views about what it's like to either work at SWYPFT or to experience services at SWYPFT. So we had I was really excited actually having a hashtag, which probably gives something away about my age and technical ability, but we had a hashtag. And just, sorry, I'm done. Don't rush me, Andy, I'll lose my throat. So I really want to talk a lot about this because it was really important. So we were really grateful actually to our members and our governors who really supported us and helped plan and challenge our thinking, but also helped garner views from communities. Some led sessions directly for us, and others linked us into organisations that we might not otherwise have heard from. So very, very grateful to John and colleagues for that. We were really keen, you've seen our extensive communities, we've on a few slides now, we were really keen that we engaged with our communities, and I'm really proud that we heard over 1,500 voices, which really fed into the really rich feedback about our services. We used our connecting people approach, which you've heard before, and we really wanted to make sure that we were accessing all different groups. So at a halfway point, we stopped and looked at where there was voice that was missing, and then actively sought out to hear from hear those voices. For our colleagues, I'm really proud that we got just under a quarter of our colleagues directly contributing to the conversations, and I'm really grateful to our board members who led and attended sessions. We had a a number of volunteers that led sessions out of hours, that did outreach work, so that again we made sure that we heard staff voice from across the organisation, not just those that find it easy to come to a session of an afternoon. We had a number of different ways. We had surveys, we had digital media, and we had face-to-face, and we did bribe people with a lot of cake, which seemed to be quite successful most of the time as well. We were also really keen. Mark talked about our list of partners. We have an extensive list of partners that we deliver services with and on behalf of. So we wanted to understand their experience of working with us and what their views were about how we could improve and build on the future. And every single one of the partners that we engage with responded fully to our requests. So I think that says something about the regard in which we are held. So I really want to give a huge and heartfelt thank you to everybody that was so generous with their time, their feedback and their thoughts. And quite rightly, some of that was really difficult to hear. So it wasn't a sort of soft, superficial exercise. There was some really rigorous feedback that has really tested us in terms of how we respond. And that gives me a real confidence about the strategy that we're about to launch today. Thanks, Andy. So just a little bit more on our inclusive approach. The feedback that we have from our communities and our colleagues continuously is it's really irritating if somebody turns up 1 month to ask a question and then somebody else turns up to ask the same question the next month. So we did also use information that we already knew. Mark's mentioned our staff survey. Amy mentioned friends and family. We had the NHS birthday, 75th birthday not long ago. So we have our insights from our communities that we collate and review every month. So we took that into the funnel that you can see here as what we already knew. We took themes from our strategic analysis. So every year we do our SWOT and PESTLE, which means we have a really good look at opportunities and threats internally and externally from a board perspective and look at how we can mitigate some of those. So we had that in there as well. As you'd expect, we undertook a full equality impact assessment of the strategy refresh and had some really interesting and helpful themes. And as part of our analysis of the raw data that we had, it was really interesting to see the correlation across the different sources and things that were out with that. So ultimately, as I summarised before, our All of Us conversation touched our communities and our workforce and our partners and really formed the basis of our thinking. And of course the next question is, well, so what then? So all that pulled together into a really strong conversation about why does this matter? Because anybody can write a really pretty strategy that sits on a shelf, but it's only helpful if it really makes real what we do every single day. And I'm going to let Sonia give an example of how we make some of this real.
My name's Sonia Zoref. I run a mental health charity in Huddersfield and serve the wider area of Kirklees and beyond. We run creative writing workshops as a medium for exploring mental health and helping improve general well-being. We were recently invited by SWYPFT to do some training courses that gave us more information about how SWYPFT want to improve the mental health services in West Yorkshire. And as a ground roots organisation, the feedback that we felt overall was that it's to individuals wanting more one-to-one intervention and help when their mental health's actually in decline. We felt that person-to-person interaction proved best, and also more responsive outcomes would be welcome whilst being mindful, obviously, to GDPR guidelines. We at Serendipity endeavour to signpost to statutory services like SWYPFT, where rigorous safeguarding tools highlighted as vulnerable. Remember that healing and recovery can be achieved. Some of the work Serendipity has done in partnership with the Creative Minds team can highlight that. Thank you.
So that's why it matters, because it gives us things that we can, actionable insight, give us things that we can really help change what we do. So pulling all this together, and what does this mean for us going forward? So we have our arrow, which is to symbolise progression, and we have our 3 strategic aims. And first of all, we have our first aim, which is around we will live our values. You've heard every speaker today talk about our values, and that's really important. It's the starting point for everything that we do. So it's at the bottom because it's the first thing that we do, in the first place we always come back to. We've also promised that we'll be the best that we can be. Now, we've borrowed that language from recovery language, because this is about how we think and we do our very best every day in what are really challenging circumstances sometimes. And within that, we've got 4 themes, and I'll come back to the jigsaw pieces in a later slide. Finally, we want to be ambitious, but we want to be ambitious for our communities and our colleagues, not just for a bricks and mortar of the organisation. And I'll come back to that again later on, because that's really important. And ultimately, our purpose, which was universally recognised by everyone we spoke to, this is about helping people reach their potential and live well in their community. And you've seen some examples from quality that Amy shared about how we really try and focus on communities. That's where people live. That's where we need to deliver our services where we can. So we've got a lot. You've heard a lot today around hope. There's an awful lot of hope, and I think we are hopeful and excited about the future. However, hope is not a plan. So you'll see the ruler on the left-hand side of the arrow, and this is about measurement. So this is about how we understand and we translate this into what we do every day, and how that builds over the coming years to get us to the position that we want to be in. So I very much think that hope is built and developed on action and impact. And that's what we want to do throughout our strategy. So things change. When we did the last strategy refresh, I'm sure we didn't plan for a COVID pandemic, but what this gives us is a North Star that we can guide our thinking and our approach going forward. And we're doing this very much in an improvement and a measurement lens. So I'll just very quickly say something about each strategic aim. So our first one is our values. These, you'll recognise our values here, and you'll recognise some of the behaviours over here. What's really interesting when you talk to staff is they don't rehearse these by rote. So they've not learned just the words, but what they've really understand is the meaning, and that's really important for us. And so what we want to do is really work through what does that mean every day in a really intentional way to build on what we have going forward. And this is what we come back to. So we're about to embark on a conversation around value and resources, and we'll do that in line with our values, and we'll do that in a very explicit way to make sure we are constantly living our values. I said we'd be the best that we can be, which is our second aim. And these are jigsaw pieces, because these only work when they click together and they link together. So we talk about having the best quality and safe services that we can have. We talk about being the best place to work and learn, because we're all on a journey and we're all learning every day. And there's something about how we develop and nurture our colleagues within that. We talk about being the best partner. You've seen throughout presentations today that we can really only be the best we can do by working in partnership, even when that means we might have to make some tough decisions as part of that. And we're talking about providing the best value. So although we are strong as an organisation, Adrian outlined, we do have some financial challenges, but it's not just about finance, it's about sustainability, it's about how we use all our resources really wisely to be the best value that we can possibly be. And then the final strategic aim is around our ambition. I'm not going to go through these in the interest of time, but it's really important, as I mentioned earlier, that we are ambitious for the people we serve and our colleagues. So this is about nailing our colours to the mast around what we want to be recognised as being outstanding for. And that's not outstanding in terms of CQC, meaning outstanding is in our values. We always aim to improve and be outstanding. And we want to be able to demonstrate some of our compassionate leadership approach and the impact that has nationally. We've talked about our community-based services, and we've talked about our excellent forensic care. We've also talked about health inequalities, which is, as John mentioned, is a really big focus for us going forward. For fairly obvious reasons, we've got to be inclusive in how we deliver our services and how we measure our outcomes. Next slide. So this just pulls things together in one slide, and the pain that went into figuring out what goes into one slide, I can't tell you, because what we're really thinking about is how do we make this real and relatable? And it's got to be meaningful for everyone. So for each of our strategic aims, we have set out objectives, and we co-created those across the organisation at some of the meetings that Mark mentioned with our senior and middle managers and some of our frontline staff. We're looking at a sense of what does it look like if we get this right? Because when we're so busy doing the day job, we're doing all the urgent things, and we also need to make sure we remember the important, what does 2 years' time, what does 3 years' time look like? Because the time arrives, whether you plan for it or not. We're looking at metrics. So again, I talk about the ruler and the metrics and the measures because we want to be innovative and creative. So if we're being creative enough, some things that we do won't work quite as we thought, and that's okay. So that's why improvement and measures and method is really important. And then what we do for the ambitions is a similar kind of thing, which is what's the nirvana? Where do we want to get to, and how do we make sure we get there? So I said before, this is not just a glossy document, and it really isn't. If we get this right, everybody in the organisation will understand how they can contribute to this broader strategy and particularly our objectives. And that really does matter. The clearer that we are with our colleagues about how their role in that, and the clearer that our colleagues are around them being empowered to own it, to drive some of the change and some of the innovation, the better we will be. So we've got individuals, we are using the strategic framework as a framework for our annual planning process that is just about to start, and hopefully that you can see how it all links together from right at the top of the organisation right to the front line. Again, it's a very learning and improvement approach because we'll need to learn how we do this as we go. We'll get some things right, and I'm sure we'll get some things wrong. But the important of the feedback loop and the measurement is how we correct our course for that. Thanks, Andy. But that's really been the easy bit. So all this has been really necessary, but it's not enough going forward to really drive some change. It's not sufficient. So the next bit is making sure now we take the inclusive approach that we've taken to getting this far into how we deploy it, into what we do every single day. So you'll see things on here like co-creating measures and what we monitor, because those closest to the action know what's most meaningful, either for them or for their colleagues. So we need to constantly be clear about our compassionate leadership, and then that enables us to have our compassionate accountability to understand better where we're progressing or where we're not. I've talked about the annual planning, and we were working up the detail. John hasn't been with us a long time, but is already starting working with us on the people elements and how we really make sure we get the shared leadership throughout the organisation, which is going to be really important. Lucock said no individuals can whistle a symphony, and we've got a really big orchestra at SWYPFT of nearly 5,000 people and then people in our communities. So there's something about how we use our strategy to be our North Star to really move us forward. And as I said before, it's not my strategy, it is our strategy because we are all of us in mind. Thank you.
Okay, thank you very much indeed, Dawn. So I hope today there is a statutory duty. We've actually gone through the annual report. I think, Mark, thank you very much indeed for your presentation. I think that gives an insight very clearly as the Chief Exec leading an organisation of 23-24. We then looked at our quality accounts and the quality of services, acknowledging there are areas clearly we need to improve on, but there are areas we're really proud on and really proud of what our staff are doing for our service users and carers every single day. So thank you, Amy, for that. Financially, we're well managed. We're well managed in a very difficult, turbulent environment at the moment. So Adrian, the team, and all staff involved in that, thank you very much indeed, Adrian. And then our Members' Council. The Members' Council are our eyes, ears. I always say they'll tell you how it is. And I'm pleased to say with that open and transparent relationship as a trust we have with our Members' Council and indeed our members, I always feel assured as a chair they will tell you how it is, and we are trying our level best. And again, you can see evidence of the work our volunteers, our Members' Council and all of our members do to make this the best place it can be for everybody who we seek to serve. And then finally, Dawn did our strategy refresh. What you'll find coming up to April of next year is an organisation where it's very clear about what its intention is, based on that, what we've listened to, how we'll make it better, and more importantly, how we can give people that hope. And that word hope's been used all day today. And I think as a chair, I'll just say there's one last word I will use, and that how proud I am to be the chair of the trust. I think today has encapsulated everything SWYPFT has done. We're not perfect, we're getting better. Do we want to be ambitious and be outstanding for the people we serve and for our staff? Yes, of course we do. And with all of your help and all of us, we will make that possible. I think SWYPFT's had a really good 23-24. I think 24-25 and beyond. I think all of us are responsible for making it better for everybody. So on behalf of myself today, thank you very much indeed for attending. The final bit for us is to then open it up to questions. You've heard a lot from us as an organisation. As I say, I hope it's given you an excellent insight and a peek into the future about ambition, where we're going. So on that basis, I'm going to open up any questions from people either in the room. I don't know if there's any members of the public. Andy, had any questions in?
Paul has some questions.
Paul's got some questions from the member of public. Okay, so Paul's got the microphone. Is there anybody in the members of the room first? Anybody who'd like to ask a question? And as I say, if it comes to any director, if the director can come and speak at the lectern, please, because that's how we can hear it. So any questions from anybody in the room so far? Okay, members of the public then? It's a bit like one of those, you know, when you're selling your house online. Next bid, next bid. Online then, thank you.
Okay, we've just got a few. With the pressures on the public sector finances having an impact on the NHS, what assurances can you give that delivering safe and good quality care remains a priority?
Mark, do you want to take that? Thank you.
So I think that's actually quite an easy question to answer, because safety is our utmost priority and always will be. To maybe just expand a little bit on how we assure ourselves. So clearly, as we move into more challenging financial times, there'll be more pressure on finance and how we spend our money. For any programme of work where we're looking at cost efficiencies, we have to do something called a quality impact assessment. Actually we do an equality impact assessment as well, but from a quality perspective, if we're looking at making a change to a service, we assess all implications we can consider, what will happen to quality as a result of making that change. So that's a practical answer, but what I can absolutely assure anybody is that we will always put safety first, and I think that's the minimum anybody coming into our care can expect.
Okay, thank you, Mark. Anybody else in the room, or are we going to go back online again? Yes, John.
Well, I'd just like to say thank you very much for all the speakers who's put out an excellent contribution to today. I think they've put a lot in these couple of hours, and there's a lot of work gone into preparing all these things, and it just reassures me, and I'm sure it reassures everybody else, that the amount of work that's gone in and where we're going to progress in time. It's not a matter of, well, I don't know, well, all this. It's all factual, and things are going to progress as we go down that line. And I'm very pleased to have been here today. I think it's been very worthwhile and very, very productive. I think really it could have done with a little bit more time rather than a couple of hours. I mean, there's a lot to take in there.
There is, John. Thank you very much indeed. So
thank you for chairing.
Thank you, John. Okay, that's an observation, so thank you for that, John. It's very kind of you. Paul?
How is the increase in demand for mental health services impacting on the Trust, and what are you doing to ensure you can provide good access to services?
Okay. Mark, do you want to... Yeah, try again.
So that's interesting, because actually when you look at our services, like we said earlier, we've got so many different services, and demand is different for each of the services. How do I answer that for something like ADHD, where we've got a 560% increase? It's difficult to answer. Our teams certainly look at what other changes they can make to how they provide the service, whether that be how efficient they are, how they can use technology, the ways of working. But quite frankly, one of the challenges we've got, obviously, the demand is increased waiting times. That's a more extreme example. I guess as an organisation, and I think one thing Dawn is, as well as leading on strategy, leads on change as well. And we promote a culture of improvement. So I think for all of our teams, what we're expecting is how can we do things differently and better to actually meet increasing demand. Clearly, I think reading the DARS review and actually hearing quite a lot of other national guidance and conversations in the last couple of years, I think there's a strong view that the NHS hasn't used technology as effectively as many other sectors have done. So we'd like to think there's a potential opportunity using technology that might help us be more effective and efficient in how we provide our services. Working with partners, again, I think is really key, because actually it might not be us in our organisation that are best placed to provide the care. It might be through the voluntary sector. It might be signposting people to other parts of the NHS or local authorities. But I do think working in partnership, and we've seen that quite a lot over the last 2 or 3 years, working with our partners, we can actually look at the whole pathway, because where it can get a little bit confusing, I would imagine if I'm a service user, is we're actually pigeonholed, aren't we? We are a mental health and community provider. Other organisations are acute providers, primary care. Actually, the service is about the person. And it's actually how do we come together as organisations to provide the best care to wrap around that individual person. So I can't answer that question fully, because the demand is absolutely challenging, and it isn't just the numbers. I think it's been alluded to a few times. It's the complexity and the acuity of individuals that require our care. But hopefully that gives some level of explanation as to what we're doing in the organisation.
Okay, thank you, Mark. Anything else online? One more, okay.
As the NHS looks set to change around us, regionally and nationally, what do you think will be the focus for the Trust in the future?
Dawn, do you want to? I think you've probably answered that, but I think it's probably worth. Yes, if you don't mind, Dawn. Thank you.
Thank you. So the answer is we'll live our values, we'll be the best we can be, and we can be ambitious for the people we serve and our colleagues. I think that's the point of the strategy. So our courses, we have our North Star of our course. There are things that we want to achieve in there around quality, around safety, around health and equalities, and we'll look to achieve those. We absolutely recognise the world will change year on year on year, but we've got our commitments around how we live our values and things that we absolutely need to deliver. With the review process and the improvement process, we look at that every year. So our chart may well change, but we've got our focus in with our new strategic intent.
Okay, thank you very much indeed, Dawn. Anything else in the room? Okay, well, it's incumbent on me to close the meeting, but before I do, there's a couple of thank yous I'd like to make. When I say a couple, it's many thank yous, actually. I'd personally like to thank the board, the Unitary Board, Chief Exec Mark and all executive directors. Thank you very much indeed. I do think you do a sterling job. It's not easy, and I'm very, very proud of you indeed. So thank you to every single one of you directors. The next team on the board are the non-exec directors, and we've got 2 leaving. Mandy Rain is in the room today, and we've also got Kate Quayle leaving today. I will miss Mandy immensely. She's been a fantastic deputy for me, and as will Kate, who's been here for 7 years. So Mandy, Kate, on behalf of myself, thank you. Mark's already said we've got a couple of new non-exec directors starting, and I'm looking forward to that. But to every other single non-executive director, we've got Afana Mahmood in the room today as well, and my other colleagues, thank you very much indeed. I couldn't do the job and be supported doing this role without you, so it's a heartfelt thank you to the non-exec directors. The next group are our governors, Lead Governor John Laville and Claire the Deputy, and all the members' council and governors and members in the Trust. Thank you very much indeed. Your honesty, your openness and your transparency transforms lives. And on behalf of myself and all of the board, thank you very much indeed. Finally, for all of our staff, everybody here today and all the staff, we wouldn't be who we are without every single member of our staff. And I can honestly say it's the staff that make the organisation what it is. So on behalf of myself to every single member of staff in our organisation, thank you very much indeed. And to all those patients, carers and service users and all carers involved in looking after people, supporting people in their lives, we will try our level best to make it the best we can be. I think Dawn's already said that, for every single one of you. And you must always tell us when it's not, so we can try and improve and continue to improve moving forward as an organisation. So on behalf of myself to you today, thank you very much for attending. Thank you to all of those online. It's been an absolute pleasure to present the annual report and accounts for SWYPFT for 23-24. And have a good afternoon. Thank you very much indeed. Thank you.
Thank you.